Ugochukwu Maluze. I'm presenting from Australia. A research was done with the Torrens University, Australia. The title of the research is Risk Factors Affecting the Prevalence of Breast Cancer Among Female aged 40 to 69 years in Australia. Introduction. Globally, the prevalence and occurrence of female breast cancer has become a public health issue. Breast cancer is defined as invasive malignant cells in the breast tissue that undergo cell proliferation and extends to other parts of the body through the lymphatic system. In Western populations, breast cancer has remained the most common cancer among women and the main cause of death. In spite of several epidemiological studies conducted to identify the risk factors that predispose an individual to breast cancer, it has become difficult to lower the incidence and prevalence of the disease. It has been documented that approximately 1.38 million people were diagnosed of breast cancer at the age of 40 years and above, and roughly 60% of death rate has been recorded in developing countries with poor income status. Advances in cancer screening, detection, and treatment have improved the survival rate of breast cancer in high-income countries. Based on the evidence, the survival rate of breast cancer in high-income countries over the 5-year survival rate was 80% when compared with 40% in some countries with low-income status. The significant decrease in the mortality rate and increase in the rate of survival are due to success in mammography screening and treatment in countries with high income status. The incidence and prevalence of breast cancer in Australia is escalating, and it is regarded as the second most common type of cancer among women above 40 years of age. Data from the Australian Institute of Health and Welfare Cancer Database have reported the prevalence of breast cancer with increase in age, which varies in different states and territory. In 2008, the number of Australian women diagnosed of breast cancer at the age of 40 years and above was 13,567. Of this number, the percentage of women diagnosed between 40 to 69 years was 69%, and above 70 years was 25%. With 5 years prevalence rate in different states and territory, the number of women diagnosed with breast cancer in 2004 was 4,027 in New South Wales. Aims and objectives of the study. With the availability of documented evidence, the aim of this study is to investigate the risk factors affecting the prevalence of breast cancer among the female population aged 40 to 69 years in Australia, as requested by the National Breast and Ovarian Cancer Center. The objectives of this systematic review was to identify the risk factors associated with increase in female breast cancer. These risk factors were age, family and genetic history, increase in breast density, inadequate physical activities, obesity, smoking, alcohol, fat consumption, pregnancy termination, postmenopausal and endogenous hormones, oral contraceptives, and hormonal replacement therapy. The objectives were accomplished by looking into the different studies conducted in Australia. References was also made in other studies conducted outside Australia to see that their findings on the risk factors of breast cancer were consistent with the findings of studies conducted in Australia. The following research questions were addressed. What is the risk factor that increases female breast cancer in Australia? What are the socioeconomic factors and individual characteristics that increases the risk of breast cancer among this targeted age group population? What are the current intervention strategies to reduce the risk factors associated with high prevalence of female breast cancer in Australia? Literature review. Increase in age of the menopausal of the population increases the risk of developing breast cancer. According to a surveillance and epidemiological studies conducted in USA, in the United States of America, it was documented that 1 in 2002 females were diagnosed with breast cancer. Based on the literature evidence documented by the Australian Institute of Health and Welfare, the percentage of women diagnosed with breast cancer above 50 years of age was 77%. Genetic factors have been recognized as a factor that predispose women to the risk of developing breast cancer. Literature evidence have suggested that the percentage of women diagnosed with breast cancer are associated with the family history was 20 to 25%, of which approximately 5 to 10% of this population were associated with autosomal genetic inheritance. According to the information documented by the Collaborative Group on Hormonal Factors in Breast Cancer, it has been reported that women experiencing delay in their menopausal state increases their risk of having breast cancer by 3%, which can be increased to 17% in every 5 years. Women experiencing their menopause at 55 years and above increases excessive consumption of alcohol among women has been established as a risk factor for breast cancer. According to recent epidemiological studies that was carried out, it has been documented that women consuming 10 grams of alcohol daily increases the risk by 7.1%. It has been established that physical activities are inversely related with risk of breast cancer. Adequate physical activity helps to keep fit, maintain the normal body physiological activities, and reduces the risk of obesity and breast cancer among the adolescents. According to a documentary report from the Australian Bureau of Statistics, it was established that women from Aboriginal were engaged in less physical activities per week, and these have predisposed them to a high risk of breast cancer when compared with non-Aboriginal Australian population. The American Cancer Society Journal have reported a strong evidence that increase in smoking increases the risk of breast cancer, and women that participate actively in smoking have about 24% increase in the risk when compared with 13% of risk among the inactive smokers. Materials and methods. Eligibility criteria and study selection. Studies were included in systematic review if they met the following criteria. The population included women at age of 40 to 69 years. Cohort studies, case control studies, and random control studies were included on the studies. Studies selected includes author's name, year of publications, and the study design. Population with risk factors such as family history and genetic, lifestyle factors, reproductive and menstrual histories, socioeconomic factors such as type of residence, marital status, education and occupation, exogenous and endogenous hormones, breast conditions, and body size were all included in the study. The quality score was 73% and above. Type of participant for the study. The participants that fall within the age group 40 to 69 years were included in this review. The participants were selected from the random control trial, cohort studies, and case control studies. For references and consistency purposes, studies conducted outside Australia were also included to ensure that their findings are inconsistent with the findings of studies conducted in Australia. Studies will indicate a wider generalization if the results of the investigation are consistent using the same targeted age group on the participants. The levels of evidence for the selected studies. Strong evidence comprises of randomized control studies, cohort studies with high quality, consistent findings. Moderate evidence comprises of single high quality cohorts and 2 high quality cohort studies. Limited evidence for the study comprises of single cohorts, 2 case control studies, and 2 cross-sectional studies. Ethical consideration. This systematic review was conducted without the ethical approval as it was not required. This is because the clinical details of the participant were identified. The study selections. For this study, the computerized search included 742 articles that were searched for these studies. Only 24 studies met the inclusion or eligibility criteria for this review. 23 studies investigated the lifestyle factors, genetic and medical factors contributing to the risk of breast cancer among the targeted population. 1 study investigated the socioeconomic factors predisposing the population to the risk of invasive breast cancer. The reason for choosing the studies that met the eligibility criteria were consideration on the physical activities, nutritional intake, smoking, genetic and family history, hormonal replacement therapy, menstruation stage, rural and urban resident, education and income status. Description of studies. The study conducted as 1 study was randomized control studies, 16 studies were cohort studies, and 7 studies were case control studies. The sample size for cohort studies ranges from 204 to 200,000. And for the case control, the sample size ranges from 98 cases to 98 and 67 controls. All the studies involved a population-based study. Majority of the studies were conducted in Australia. For the purpose of references, generalization and consistency of studies, only few studies were done in New Zealand, France, Norway, and the United States of America to ensure that their findings on the risk factors of breast cancer were consistent with the findings of the studies conducted in Australia. Methodological quality of included studies, evidence-based synthesis. Following the criteria and guidelines for the methodological qualities, the scores for the quality assessment were expressed in percentage and were graded from 72 to 85%. Using 79% as the cutoff score, it can be seen, it was documented that only 12 out of 23 studies were considered to be on a high quality standard. Studies on physical inactivity shows a strong evidence, and as this involves 1 randomized control studies and 2 cohort studies that has a generalized, consistent findings. Studies on the exposure to postmenopausal hormones and oral contraceptive demonstrate moderate evidence. which involves 2 cohort studies and 4 case control studies. Studies on alcohol consumption shows a strong supportive evidence as daily alcoholic consumption contributes significantly to the risk of having breast cancer. These studies involve 3 cohort studies and 2 case control studies. Studies on cigarette smoking, age, fat consumption, and obesity have been supported by only 1 study, indicating limited evidence. Risk factors and risk level. Physical inactivity has a low risk with a strong evidence. Postmenopausal exposure to hormonal replacement therapy has a moderate evidence with a moderate risk of breast cancer with moderate evidence. Pre- and postmenopausal obesity has a moderate risk with strong evidence. Postmenopausal obesity has a high risk with strong evidence. Alcoholic consumption has a low risk with strong evidence. Cigarette smoking has a low risk with limited evidence. Body mass and obesity has a moderate risk with limited evidence. Family history has a high risk with moderate evidence. Fat consumption has a low risk with limited evidence. Age has a high risk with limited evidence. Discussions of the research. Physical inactivity. Physical activity is a risk that affects the prevalence of breast cancer, and it has been identified on the research to be inversely associated to the development of breast cancer. Three studies of the studies, which comprises of 1 randomized and 2 cohort studies, examines the relationship between physical inactivities and breast cancer. The study on cohort study indicates a high quality score that is above the mean cutoff for quality assessment. With strong evidence, the studies found a strong association between physical inactivity and the risk of breast cancer, and this was found consistent with the previous findings documented by the World Cancer Research Fund and American Institute for Cancer Research. Postmenopausal exposure to hormones and oral contraceptives. 2 prospective cohort and 4 case control studies were used to establish the association and impact of postmenopausal exposures and oral contraceptives to the risk of breast cancer. 3 case control and 2 cohort studies were identified with high quality standard. There were sufficient strong evidence to establish that pre- and postmenopausal exposure to hormonal replacement therapy increases the risk of breast cancer. Alcohol consumption. 3 cohort and 2 case control studies were used to investigate the link between alcohol consumption and predisposition to the risk of breast cancer. Of these studies, only 2 cohort and 1 case control studies were of high quality, with a quality score above the mean quality assessment score. With strong supportive evidence, the findings of the study demonstrate that daily consumption of alcohol increases the risk of late stage of breast cancer, and this has been found to be consistent with the report documented by the World Cancer Research Fund and American Institute for Cancer Research. Family history. The association of family history with breast cancer was investigated in this study using 2 cohort studies that of high quality consistent findings. With moderate sufficient evidence, the studies identify that family and genetic history increases the risk of breast cancer among the targeted participants. And this has found to be consistent with the findings of previous studies. And the targeted participants were women between age of 40 to 69 years in Australia. 8. Cigarette smoking and obesity. The influence of age, cigarette smoking, and obesity in breast cancer was established using 3 cohort studies with low quality score. With limited evidence and consistent findings, the study found that these risk factors increases the risk of developing female breast cancer. Area of residence. The impact of socioeconomic factors on the risk of developing breast cancer has been investigated in the study. In this study, it was reported that women residing in rural remote areas have a late stage of breast cancer when compared with those residing in urban metropolitan areas. This is because they experience difficulty in accessing the breast cancer health services, such as mammogram and self-examination screening, which put them at risk of developing the disease. These findings have shown to be consistent with the previous findings of various authors and various previous researches conducted, showing the differences in the prevalence of breast cancer in urban and rural regions. The odds and 95% confidence intervals of women developing late stage of breast cancer in rural area has been documented. Marital status. Another socioeconomic factor that affects the prevalence of breast cancer is marital status. According to the evidence, it was reported on the study that married women experienced a high advantage socioeconomic status when compared with unmarried women, which enabled them to have access to a better healthcare services, promoting and influencing their normal healthy lifestyle and reducing the risk of breast cancer. Unmarried women are more disadvantageous and at a high risk of being exposed to the risk of late stage of breast cancer. Considering the evidence on the studies, the odds and the percentage of married women with late stage of breast cancer is insignificantly higher than that of unmarried women. This finding is very inconsistent with the findings of various authors. Country of birth. Women that were born in some countries has been reported. Women's countries of birth has been reported in New South Wales as a risk factors for breast cancer. The high increase in breast cancer have been documented on women born in Australia and other English-speaking countries when compared with women born in another English-speaking country. And this has been consistent with the findings of these studies. Women born in Australia and speaks English have odds of a late stage of breast cancer when compared with women that does not speak English. The strength of the scientific review in a prospective cohort setting is the strength of the study, and this study has established the relationship between the risk factors and breast cancer outcome, and also compare the rural-urban disparities in the stage of breast cancer, which has been reported as the first Australian study to compare the differences in rural and urban stage of breast cancer diagnosis. Conclusion and future recommendation. In conclusion, the prevalence of breast cancer in Australia is high. In spite of several epidemiological studies conducted to identify the risk factors that predispose an individual to breast cancer, it has become difficult to lower incidence and prevalence of the disease. Detecting breast cancer at the early stage of development will facilitate for a quick response in treatment and improvement in the survival rate. For preventive measure, the use of X-ray mammography chemo prevention, prophylactic surgery or prophylactic preventive mastectomy can be used to lower the risk of the disease. However, it has been identified in the study that women residing in rural areas have low socioeconomic status, which prevent them from getting access to the healthcare services. For public health concern, these factors should not be ignored. It is recommended that mobile mammography screening should be supplied efficiently to the indigenous rural population. Women without partners, jobless, and living in rural areas may lack financial support, social and emotional support, which in turn predispose them to the risk of breast cancer. Adequate support should be provided to them, which will improve their normal, healthier lifestyle and reduce the risk of breast cancer and obesity-related diseases. Thank you. That's the end of my presentation. I will indicate on the message on the chat box my name and the email address and the website for the publication, so that you can as well, when you have time, you can go through it. Thank you so much. If you have any question, you can ask me. Thank you.